Hello everyone, I am Lamone Rogers. I am an HR recruiter and trainer for Quinton Residential Living. So today I'm going to be training you guys on the crisis intervention and prevention training. This is a training or a program that's utilized to help individuals that may be in crisis situations. So starting with Module 1, which is Understanding Crisis Behavior. But with Module 1, Understanding Crisis Behaviors, we are trying to, hopefully with our objectives, recognize the stages of escalation, understanding underlying causes, whether it's environmental, medical, or emotional, and learning staff responses and boundaries for that. So with the crisis development model, which is located in the content, you have the baseline. Baseline is going to be the plateau where the person kind of starts from, hopefully in the way that they're calm and cooperative with everything that's going on. And then you have the triggers, which is known as the anxiety level. This is where frustration, unmet needs, sensory overload, and things of that sort can happen. Anytime a person is in an anxiety stage, it is important for us as staff to be supportive of these individuals. The best way to be is sometimes to engage in sympathy as well as empathy. Okay, sympathy being support for our individuals in a way that we may not necessarily understand what they're going through, but our heart goes out to them, where empathy is going to be where you are literally putting yourself in that person's shoes, okay? It is the act of placing yourself in that person's position, and sometimes if you have experienced these same things, you clearly understand what it is that they're going through. So we do often ask our staff to show empathy, because to do so is to put yourself in their situation so that you're not being judgmental as well as taking it personal when they have some of the behaviors or issues that they're dealing with. And then number 3, escalation. That's going to be involved in verbal aggression, pacing, posturing, things of this sort. This is often known as the defensive level. A lot of times our individuals will give reasons to kind of resist you, maybe say no. This is the stage where people can shut down, or they may often just kind of decide that they don't want to be compliant with anything that you do. If in fact you are dealing with somebody in this stage, you just kind of want to be directive. Don't be the kind of staff that isn't showing any support in this situation, but also if you maybe give options and choices is always going to be very helpful. Even if you pigeonhole those options or choices, giving them a choice will often kind of help with this stage and this level of being defensive, because our individuals sometimes just need to know that somebody cares about their choices as well, even if you pigeonhole the choices. As an example, would you rather have, let's say, corn or green beans? Now to us, it's just a couple of options and a couple of choices. I didn't give them a whole lot of options, but the fact that I gave them a choice often makes our individuals feel like they belong, feel like their choice matters. And that's going to be very important, because to us it's small, but to them it may mean the world, right? So even if it's a chore, give them an option. Hey, we have to clean your bedroom and have to clean the bathroom, but which one would you rather do first? See, to give them that choice might make it easier for them, and then also easier for you in the way that you get less resistance, okay? All right, number 4, this is crisis, which may involve physical aggression or self-injurious behavior. This particular part is going to probably involve a level of risk known as the risk behavior. This is where the person may kind of once again become aggressive or display actions that could be pretty risky to self or other people. This may be the stage where you may have to engage in physical intervention if it ever reaches this stage, you just want to make sure that it is the minimum of intervention that you could possibly have, especially when it comes to physical for yourself. You don't want to do anything that can put this person in more harm and mitigate the risk as well. Okay, the idea is to maximize safety. So you just have to make sure that whatever you do is going to be least restrictive. All right, and then de-escalation will be number 5, which is going to gradually return the person to the baseline. This is often known as tension reduction. This is the stage that you want your individual in, if possible, because this is where you're going to probably get the most results in helping them get back to the baseline, which is where they started in the first place. This is also will be the stage where you as the staff will exercise in therapeutic rapport, because you're going to hopefully reassure this person that everything will be okay. So therapeutic rapport will also be where you can help this person get to that baseline in a more effective approach. And you will also assure them and reassure them that even though the crisis and the behavior did occur, that everything is going to be okay. You may use terms like, it's all good, everything's going to be okay, I'm still here, we'll get through this together. So it's kind of a reassuring stage that you will use. Causes of behavior crisis often is sometimes is what causes this person to ever become escalated in the crisis development in the first place. So it will involve communication barriers, also changes in routines, sensory overstimulation, medical discomfort or pain, and past trauma triggers. So these things may often be what causes the individual to have these behaviors in the first place. So we often say, please don't take it personal, because it's not you. It can definitely be one of these items that could have very well been the trigger or the cause as to why this person ever had the behavior in the first place. And that will conclude module number 1. All right, going into module 2, crisis prevention techniques. The goal is to build rapport and trust with the individuals, as well as use proactive interventions before crisis occurs. So key prevention strategies, starting with number 1, environmental adjustments. First, you're going to reduce noise, clutter, and overstimulation. Sometimes it's as easy as offering a quiet place or an area, maybe with soft music, to help that person to either calm down or kind of remain calm if they are still in a more calm state. Also, to maintain consistent routines. Also, be consistent with schedules and things of that sort. If you're not, then it tends to trigger the person to escalate in the behavior. So consistent routines and schedules are going to definitely be paramount, as well as great and helping keeping that person from actually getting out of character. Also, provide comfort items if appropriate. This can involve stuffed animals, fidget toys, blankets. I'm often known, even when I feel nervousness and things of that sort, and chewing gum, because it helps keeps my nerves calm. So anything that's going to help this person in the way that they have a comfort zone or something that they can attach themselves to remain calm would definitely be good. Number 2, active listening and validation. Maintain open body language. This is going to include eye contact, smiling, open posture, nodding, things of that sort, which helps the person to know that they are being heard, as well as that you are attentive to their needs and things of that sort. Paraphrase what the individual is expressing. I'm an advocate for definitely kind of paraphrase. Always repeat what you hear or think you hear, because it lets that individual know too that you are attentive to what it is that they're saying. Often they just want to feel like they're being heard. So to paraphrase this, to kind of say, hey, if I understand you correctly, this is what you're actually saying. And it gives them a chance to kind of validate whether you really do understand where they're coming from, or to once again reassure them that you are listening. It's known as active listening. Also, acknowledge feelings without judgment. It is very important that you never judge them. We don't want to be judged, and they shouldn't be judged either, right? You're listening with empathy and sympathy and making sure that you kind of understand why they may have even felt the way they are feeling or expressing themselves to feel. Number 3, clear, simple communication. This is going to involve using short, direct sentences. Try not to sugarcoat things. It might create confusion. Often our individuals can help it. They can appreciate when you're just direct and honest, okay? So you don't want to sugarcoat things. It causes confusion. And believe me, if you're honest, they can deal with it, okay? And then allow processing time. Definitely. Give them time to process what you may have just said so that they understand what you're trying to say or what you mean when you say it. And then use visual cues or communication boards if needed, especially if you're dealing with someone that's nonverbal and may need other forms of help to comprehend messages and what you may say. That kind of thing is going to be very important because it keeps that person from clamming up and resisting communicating as well. And then number 4, choice and control. Offer limited, acceptable choices. Once again, as examples, even if you pigeonhole those choices, just give them an option. You'd be surprised at how much it helps that person feel comfortable and secure in being able to communicate and maybe resist the temptation of wanting to be defensive and therefore shutting down or telling you no and things of that sort. And then allow space and time for the decisions, okay? Sometimes it's hard to do, but we definitely have to be very patient in dealing with these individuals who may just have a hard time or difficulty in expressing themselves. And that will conclude module number 2. Okay, we are now moving to module 3, which is verbal and non-physical de-escalation skills. The goal is to calm an agitated person without physical intervention and to reduce risk to self and others, okay, whoever may be present. The techniques involve tone of voice. Always make sure you remain calm. Speak slowly, as well as keep your volume low and appropriate for the situation. Okay, with body positioning, this definitely speaks to a person escalating in their behavior. You want to stand at an angle, not face to face in confrontation. You also want to keep your hands visible and relaxed, okay? And maintain at least 2 arms length in distance. This assures a safe distance so that if anything were to happen, you have plenty of time to react, and also in a manner that's going to be more safe and secure. Also, use diffusing words. Examples: I want to help. I'm here to help. You are safe here. Let's work on this. Tell me how you're feeling. These words are going to be examples of what will usually kind of help the person to stay calm or once again de-escalate so that they're not looking to be more confrontational or escalate in their behavior. Okay, distraction and redirection. Offer alternative activities. Those activities could be anything from playing a video game or maybe getting out a coloring book. Sometimes that's going to be great distractions in the way that you help the person realize that maybe at that time it wasn't safe or good to keep them on the topic that escalated their behavior in the first place. but let's get them onto something else that might help to calm them down and to distract them so that they can start to de-escalate in their own behavior and attitude as well. Okay, sometimes change the environment subtly. That can involve maybe going for a walk, wherever the area was that caused the escalation in behavior or caused them to start to get out of character. You're changing the environment in a way that if it's nice and sunny outside and we go for a walk, the minute they get out into the open air, they're already starting to calm down. Sometimes we as individuals classify normal have to do that ourselves. Sometimes we have to breathe or we have to go for a walk, and anything that helps us to calm our own mental and perceptions of things and to help to, kind of attack whatever it is that upset us in more of a cool, calm, collective, kind of mentality. Okay. And then also remember to give time and space. Allow that cool down time in a safe, quiet location. So with that being said, it's once again very important to allow that individual time to change their energy or change their behavior. Be patient, okay? Patience is going to be something that's very important in helping to de-escalate anybody that's in crisis. And this will conclude module number 3. Okay, moving to module 4. Managing physical and psychological aggression. Now with this module, we will tap into identifying early warning signs of aggression, as well as apply safe and approved crisis intervention responses. It's interesting to me that when you're talking about different agencies and how they attack this, they have their own rules and regulations as to how they allow their staff to build relationships or get close to the individuals that they're caring for. I've learned in my own experience that it is always easier if you're allowed to get to know the individual and maybe get closer to them in the way of a friendship, because it gives you the opportunity and ability to identify maybe what the early warning signs may be of aggression, okay? So the more you know of that person, the better it is for you to see what those triggers are and what it looks like when the person starts to escalate in their behavior. So hopefully you are allowed to do so in the way of getting close to this person and getting to know them so that you can better understand how to identify what those triggers may be. The guidelines may be: do not take aggression personally. And this is very important because, once again, it's not you. You just happen to be the one there, okay? Never take it personal when an individual becomes aggressive or they start to escalate. Or, don't take it personal in the way that they may say things that aren't so nice or kind, okay? Keep escape routes clear. Assess every location you are at. From the time you show up, you just want to assess the area, look at where the exits are. Also, pay attention to things that may be close by that could be dangerous or used as potential weapons as this person escalates in aggressive behavior. Have a coworker present when possible. Yes. You want to always have somebody there if the person does become more aggressive, or if nothing else, someone you can always reach out to or call, okay? To have somebody else involved is to make your situation a lot easier. Sometimes the worst thing you can do is have an attitude or mentality that you can fix things by yourself and you don't need anyone's help. That may not be the best choice to make, even if it's true. It just may not work as well to do so. Having someone that can help and assist you could always be the optimum way to make things a lot easier and a lot better. Use the least restrictive intervention principle. This is going to be very important. Everything you do in the way of physical aggression, you have to use the least restrictive method and minimize your movements, actions, and everything in a way that is going to make things a lot smoother and easier for you in that sense. And then you only use physical intervention when imminent danger is present. Yeah, you don't ever want to introduce anything in the way of physical intervention if you don't have to. So only use it if you know that there's a dangerous situation involved. And this will conclude module number 4. All right, moving to module number 5, suicide and self-harm risk response. The goal is to definitely try to respond quickly and safely to threats of self-harm, as well as maintain safety until mental health professionals arrive, okay? So procedures in this can look a little different, but primarily the same in just about every setting. Number 1, immediate safety. You want to remove, if you can, all potential tools for harm. This includes sharp objects, ligatures, and chemicals. Sometimes, though, it's not always easy to do, and if that's the case, try to position yourself between the person and the dangerous objects, okay? Sometimes the out of sight, out of mind theory does play well into this equation, because if you can't get to those dangerous objects to remove without making it obvious to do so, then it may be just good to try to position yourself where you are in between this individual as well as the objects that can be used against you. Definitely keep calm and always use reassuring tones, okay? You want to always make sure you don't escalate in your volume and tone and things of that sort, because that could be a trigger for this individual. Number 2, verbal intervention. Use direct questions. This once again goes back to not sugarcoating things, but you want to be a lot more direct with the questions that you may ask. Are you thinking about hurting yourself? Do you have a plan? These kind of questions are much more direct and triggers that person to hopefully think about their actions and what they may be trying to do, or to engage in what they're trying to accomplish in communicating with you in the first place. I don't believe that most individuals looking to do self-harm really wants to. They just want somebody to listen to them and acknowledge the fact that they are in a crisis situation. So also avoid judgment. Listen without interrupting, okay? Once again, our individuals are looking to be heard, and they often feel like nobody cares enough to listen, which causes them to shut down, clam up, or just resist the desire to want to kind of talk because they feel like nobody wants to hear it anyway, okay? So please avoid judgment and listen without interrupting. Let them get it out before you even respond. Number 3, emergency protocol. This can look a little different for different agencies, but the plan in action is also to always follow the guidelines that are going to be secure in the way that if it's immediate danger, call 911. Get emergency involved as soon as possible, okay? Then definitely notify a supervisor as soon as you are able. In some cases, it could be a guardian or another loved one. Do not leave the person alone if they're in this kind of situation, because that could be detrimental to them as well. So you want to always keep eyesight supervision and make sure that they're not left alone where it gives them time to cause themselves harm. And then number 4, documentation and follow-up. Document exactly what was said and done. Make sure you do this. You never know if it's going to be used in an investigation, or maybe that information can be used to help the person in different stages. And then develop or update the individual's crisis plan. You're going to probably have incident reports and different documents you can fill out to inform the supervisor or other people. It could be a case manager, could be a supervisor or field coordinator, as we would call in our agency, or something that can be utilized for the state. But you want to definitely document and develop a plan for the individual's crisis so that we could find ways to minimize what the reaction in another crisis may be for the future, or to help curve what could be problematic for this person if that situation were to ever happen again. This concludes module number 5. Okay, going into module 6. This is physical restraint. It should be last resort only. As a legal and safety disclaimer though, with our agency, it is our protocol to not do any restraints to any of our individuals, especially in a solo intervention. It's just something that we cannot do. You must comply with state regulations, Human Rights Committee oversight, and organizational policy. So use only when there is imminent danger to self or others and lesser interventions have failed. Okay, the restraint principles is that it has to be least restrictive and it needs to minimize harm as well as be the last resort. Okay, if ever in fact it's necessary, you definitely want to protect the airway, breathing, and circulation of that person. Avoid pressure on the chest, neck, or back. Constantly monitor for distress and end restraint immediately once the person is safe. Okay, this is very, very important. With the techniques, it should always be non-harmful and approved methods that can even be used in the way of a restraint or hold. So number 1, with the 2-person standing hold for preventing strikes and kicks while maintaining upright position. Number 2, a 2-person's escort hold is going to be gentle guiding away from the danger. Number 3, seated containment, which is probably ideal, will be controlled sitting hold for preventing further aggression. And number 4, blocking and deflection will be redirecting limbs without any form of holding. What's prohibited is any face down prone holds, restraints that impair breathing, and pain compliance techniques. I will now demonstrate what some of these interventions may be, especially with solo interventions, and what you're able to do to free yourself from a possible hold with the individual that is in the crisis themselves. Hello, these are the interventions that goes with Module 6. I have my assistant here, Carrie. She is a part of Quentin Residential Living as well. And with her, I'm going to demonstrate some of the solo interventions as well as the team interventions that we will add a 3rd person. But right now, I'll get through the solo interventions. But just remember, it should always be least restrictive and last resort, okay? In no way should we be doing anything that's going to create harm or problems for the other person, okay? So with that being said, I'm going to start with the positioning because it's very important in every one of these interventions that you are in what they call a supportive stance, okay? This is a stance that allows you to be supportive as well as have a position where you're not easily knocked off of your position. If I stood in front of Carrie and I have my feet side by side, she could push me and I would naturally fall back. I don't have support. But in a supportive stance, whether it's your right foot forward or you could do your left foot forward, at least you're in a stance where you're more supportive and you're in a position where you can protect yourself and hopefully the individual that you're having the interaction with. So with that, I'm going to put myself in a supportive stance. I want to be at least 2 arms length apart. So as you can see, as I stretch my arms out, I'm not touching her. Even if I went in a little more, I'm still a little further away. So that if she were to come in with a strike, as she is going to demonstrate, she has to actually come toward me to make a contact or connection with that strike. And it gives me time to move out of the way and ensure that she isn't, of course, hitting me or kicking me. Same thing with a kick. Supportive stance, if she comes with a kick, she's got to come into the kick. It gives me time to react as well as be in a position to probably support, okay? So that's very important when it comes to a strike. I am now going to demonstrate what it looks like with the grab. Once again, with supportive stance, you want to be, of course, in a position where if anything goes wrong, I can counteract that. I might turn and run, or I could be in a position where I actually make sure that I'm not being harmed. But she's going to do a cross-arm grab with my wrist. So with your left hand or your right hand, go ahead and grab my wrist. The number one thing you want to always do, grab what's grabbing you, okay? But I want to treat it like it's a minimal thing because I don't want to do anything that's going to cause injury to her. But with the minimal grab, I'm only holding and supporting what's holding me. And at that time, I might ask her, are you okay? Do you need anything? Can I help you? In most cases, people will just let you go once you've acknowledged the fact they have your attention. If it happens to be a stronger grab, and I'm not really liking it, I may tell her, stop, I don't like that, okay? I'm just literally pulling her hand off. I could grab her thumb and release that way because she'd be grabbing me if she doesn't have her thumb with her, right? So if that's in the event that she's grabbing me with more intent, but at the same time not trying to harm me as well, okay? Now, if it's a real intentional grab where it's considered like a level 3, and this is with intention to do harm, I'm simply going to grab my own hand over her wrist and create a lever. I could do that same thing with just one arm and create a lever, okay? Anytime you create a lever, this is your intent to get out of the grab. Now, once I'm out of it, the best thing I can do is take off in the other direction, right? We don't ever want to impose any infliction of harm or pain or anything to the other person, okay? If she uses two hands, as she mentioned or tried to do so already, same ordeal. I don't care how strong she is. Once I bend her wrist, I just took the power out of her arm. So often you'll get a person much stronger and they may have more muscles. It doesn't matter. Bend their wrists and they can't hold on, okay? This is with a wrist grab. In the event that she's grabbing my clothing, go ahead and feel free to grab my clothes. It's going to be the same. Just use one hand in this demonstration. I want to support my own clothing, and the same ordeal, push her hand right off, okay? It's really not that hard, and you don't want to do too much in the way that you cause problems, all right? That's the most important part. Be in a supportive stance, minimize the person's risk, and anything that could cause injury to this individual, okay? So that would be what they call a clothing grab. If in the event, let's say she's trying to choke me, this is another technique. With a supportive stance, I'm going to grab what's grabbing me and move away. Notice that I hold her in place. What you do not want to do is grab and push the person off. It can throw them off balance, and now you've caused actually more problems versus make it better. But if I do it right, she's going to try to choke me. I'm going to grab what's grabbing me and move out the way. This is a minimal grab in the way of choking. If it's an intentional grab in the way of choking, she grabs me. I'm in a supportive stance again. I could raise my arm and go right through her wrist, and at that point she can't hold on. I've even held her together because if she's somebody that's off balance, I now have her in a position where I can keep her from falling forward or anything. So once again, I'm in a supportive position, okay? Very important that you have that person supportive. If it happens to be a hair grab, and ladies, this will be very important to you. Most men don't have this issue, but as you can see, she has nice long flowy hair, right? She's going to simulate by putting her hand with the palm on my forehead, and you just kind of fold your fingers. And this is her grabbing my hair. All I want to do is secure. The natural reaction for most people is to pull away. If I do that, I just helped her to yank my hair out of my head. Why would I want to do it? What I want to do is secure her with her hand on my hand, and then take my hand and move forward to chop her hand kind of off of my head. This is the kind of grab where, once again, it's not as demanding in the way that she's intentionally trying to harm me, but I do want to get her off, so I'm going to support the hand, bend down, and take her hand right off that way, okay? If it's an intentional grab of my hair, same situation. I'm going to hold what's holding me and then drive it toward her. And as you can see, her arm just bent, very uncomfortable. She's probably more apt to want to let go anyway, okay? That is a hair grab. Now, let's just say that she's in a situation where she's looking to bite. And all I'm going to do is have you act like you're biting yourself. And she will she will put her arm on my arm, and it'll help to demonstrate what that looks like. So she's acting like she's going to bite me. In the event that that happens, once again, the natural reaction is usually to yank away. That's not smart. Our teeth are meant to tear. So if I do that, I just help yank some of my own skin off. And she's probably going to be feeling very bad that she, hopefully she'll feel bad that she actually caused me bleeding. But what you want to actually do is to take that person and hold the back of their head, and while they're standing there, force feed your arm into that person's mouth. Did you feel the pressure? Mm-hmm. That is enough pressure to probably make her want to release, okay? So even if it's close, come on in with it. Same thing, supportive stance. I'm just going to bring her head in and force myself in her mouth, and that way she'll probably let go, all right? That's the easiest way. If it happens to be the leg, I would force her head into my leg. Same results, okay? Just think force feed versus yank away, and that's probably going to be the best way to deal with someone who is trying to bite you, okay? That concludes the solo interventions. I am going to do interventions when it takes two people. Okay, this part of Module 6 is going to be team interventions. I have gotten a third person as an assistant in the way that they are another staff, as I am a staff. And the person we currently have in the middle sitting down will be the individual in crisis. This will be in a seated position. So it is important for us to, once again, make sure it's least restrictive and it's the last resort. But in the event that she is having issues, me and this young lady, who's Amanda, is going to help assist me in how we even engage, approach her, as well as disband from her as well. So with that being said, you and I both are going to sit next to her at the same time. We want to have close proximity. We'll stick our leg out from the outside. This gives us the support to make sure that she's stable, right? And while you have your hands on your lap, we're just going to kind of put our wrists slightly over. This is a level 1 engage. If she ever gets a little more out of control, you know, she's not feeling right and we're sitting next to her, at that time with our outside hand, we will place it near the elbow area, come underneath her arm, and do the same kind of thing in the way that we support the wrists, okay? So can you move as much as you did at first? See, a little bit more tactful in the way that it holds her there. There is a level 3 grab. I don't necessarily recommend it. However, if needed, while the inside hand is there, we can grab the wrist, slide it all the way back, and then we will take our outside hand and cuff her hands, and we're holding real close. And this is going to minimize her ability to move or anything. She could try to get out of the seat or whatever, and it's probably going to hinder her. As she becomes more calm, we bring her arm back up and put our hand on the outside near the elbow area. She becomes better than that. Now we're going to take the arm from underneath and place it on the outside, and we will still sit in this position. This is where she's more relaxed and not feeling as confined by our motions or movements. So this is if a person is sitting down. If they happen to be standing up, and both you ladies please stand up, same kind of thing. As a minimal intervention, I'm going to grab the elbows and just hold her myself. And I'm just keeping Amanda close by in the event that it might escalate, okay? But I'm solo, and I can walk her around and, hey, I've been hearing you've been having some problems. Are you okay? So she's just following along, but she's in a very comfortable state. Now, as she starts to get a little bit more irate, hey, Amanda, can you help me? At that point, we're going to take our hand on the outside again, come up under, and we're holding her in a position with the arms relaxed, making sure, and once again, close proximity with the hips, to just make sure that she's okay. And if we need to, we can hold her together and keep her from being able to move too much. And in the event it got even more out of control, we'll grab her wrist and then pull her back again. Same scenario with sitting down with our outside hand, close the fist, and now we have her in a very close proximity where she can't do too much moving. You know, she's very much restricted and that kind of thing until she calms down. As she calms down, we'll put her back in position 2 with the outside hand on the elbow. This keeps her from being able to swing her arms and hit us and that kind of thing. Still close proximity. And then if she gets to where she's calm again, I can now ask Amanda, yeah, go ahead and let her go. And I will grab her by the elbow so that I keep her range of motion still constricted a little bit and I have control over her in a calm state. Okay, this is the beauty of a 2-person intervention, because the best thing about it is that there is a witness as well. Anything goes wrong, I have somebody that was there that can vouch for what I did and the fact that both of us together didn't cause her any problems, any harm, and therefore inflict any pain or anything on her as well. This concludes the 2-person intervention that goes along with Module 6. All right, going to Module 7, Post-Crisis Recovery and Documentation. This is typically after the crisis is over. Okay, so the goal is to restore safety and trust after an incident has happened, and also learn from each event to improve prevention. This is going to involve supporting in the present, understanding the past, planning for the future. So with supporting the present is kind of rebuilding a relationship and building bridges of that communication. With the understanding of the past is reflecting on what has happened and how things got out of control probably in the first place, and then what impact it did have, as well as planning for the future, which is the approach and collaborating to solve the problem and hopefully keep this situation from ever becoming an issue again. Okay, steps to this may involve a medical check. Number 1, ensure the person and staff have no injuries. Number 2, emotional support, offer comfort, allow rest, avoid immediate discussion until calm. 3, debrief with staff and, if appropriate, with the individual who was in the crisis situation in the first place. Number 4, documentation, incident report, witnesses, interventions used, duration of restraint. And finally, number 5, review care plan, which allows you to adjust triggers, strategies, and environmental supports so that we can be proactive in helping our individual in any post-crisis situation. This will conclude Module 7.